Hey everyone, and welcome to our deep dive today, all about menopause.
Yes, menopause.
We're going to be going way beyond just hot flashes.
Yeah.
We're going to be looking at all sorts of different ways that it can impact women's health in the long term.
Absolutely.
And we're really lucky today
Yeah.
to have some amazing insights to guide us from the work of Dr. Henry Wu.
Oh, he's great.
He's really a leading expert in this field of hormone optimization and longevity.
Yeah.
And, you know, one of the things that's really interesting about Dr. Wu is that he specializes in BHRT, which is Bioidentical Hormone Replacement Therapy.
Yes, and it makes such a difference.
But his approach really focuses on treating the whole person, not just, sort of slapping a Band-Aid on symptoms as they pop up.
Exactly. It's about understanding that everything's connected,
Right.
And I think that's what's so fascinating about Dr. Wu's work is that he really delves into this complex interplay of hormones during and after menopause. A lot of women think menopause is all about, hot flashes and irregular periods, and that's it.
Right, like you just get through those few years of discomfort and then you're good.
Yeah, exactly. But Dr. Wu's work really paints a much broader picture. He uses this really cool visual in his book.
Oh, yeah, I saw that.
It's like a bubble illustration showing all these different symptoms that women can experience.
Yeah, it's like this hidden web of symptoms you wouldn't even think about.
Right, and it's not just physical either. We're talking, joint pain, sleep problems, but then also emotional shifts like mood swings.
Oh, for sure.
Anxiety, brain fog.
It's all connected.
It really is.
And, it makes you realize that menopause isn't just about our reproductive system shutting down.
Yeah.
It's like a whole body experience.
Exactly. And one of the things that really surprised me was learning that for Asian women,
Oh, okay.
joint pain is actually the most common symptom.
Really? Even more than high flashes?
Even more so than hot flashes. In fact, there was a study in Taiwan that found over 82% of women experienced joint pain during menopause.
82%. That's huge.
It is.
So, if you're listening to this and you're dealing with joint pain,
Yeah.
don't just brush it off as, oh, I'm getting older.
Right.
This is just part of aging.
Exactly. It could be hormonal.
Yeah, it could be directly related to those hormonal changes that are happening.
And there might be ways to address it.
Exactly.
Yeah.
So it really challenges that common perception of, what menopause is all about.
It does, doesn't it?
So let's dig into that a little bit.
Okay.
What's actually going on with our hormones that's leading to all these different symptoms?
Well, it really comes down to the decline in estrogen and progesterone.
Okay.
And, these hormonal shifts, they can disrupt your body's delicate balance and affect so many different things, from sleep to mood, vaginal health, even how your bladder functions.
Oh, wow. So many things.
It's like a domino effect.
It really is.
And I think it's important to understand how these hormonal changes can also impact the autonomic nervous system.
Okay, so for those of us who aren't doctors,
Right.
break that down for us.
Sure. So the autonomic nervous system, it controls a lot of your body's automatic functions like heart rate, breathing, digestion,
Oh, right.
things you don't have to think about.
Right.
But when those hormone levels fluctuate, it can really disrupt that balance and lead to symptoms you might not even realize are connected to menopause,
Like what?
like dizziness,
Okay.
ear-ringing dry eyes, even dry mouth.
Interesting.
Yeah.
So even those seemingly like completely unrelated symptoms could be traced back to these hormonal shifts.
Exactly. And what's interesting is that research has shown that hormone replacement therapy, or HRT, can actually significantly reduce the risk of vertigo and tinnitus,
Which is?
that ringing in the ears.
Okay, that's good to know.
Yeah.
Now I want to kind of zoom out a little bit because managing those immediate symptoms is important. But we need to think about the long-term health implications of menopause as well.
Right, long term.
We often hear about, increased risk of osteoporosis, heart disease, even cognitive decline.
Yeah.
But there's also a lot of conflicting information out there,
Definitely.
especially when it comes to hormone therapy.
For sure.
Remember the Women's Health Initiative study, the WHI?
Oh, yes.
That really kind of shook things up when it was first released.
It did.
Because those initial findings created a lot of fear around hormone therapy.
A lot of fear.
And a lot of women stopped taking HRT altogether based on that data.
Yeah, it was a big deal.
But the crucial piece here is that those initial findings were based on short-term data.
Right, short term.
And Dr. Wu really dives deep into the long-term follow-up data from the WHI study. And it paints a very different and arguably Much more reassuring picture.
Much more
So
reassuring.
does that mean we shouldn't be concerned about hormone therapy at all?
Well, it's not quite that simple,
Okay.
but the long-term data shows that estrogen-only therapy actually reduced breast cancer risk
Oh, wow.
and didn't increase overall mortality.
So it's like that initial panic was maybe a bit premature.
I think that's a fair assessment, yeah.
But that fear around breast cancer and hormone therapy is understandable.
Oh, absolutely.
It's like the elephant in the room.
It is.
So I think we need to talk about that.
Yes, definitely we need to differentiate between the types of progesterone used in the WHI study,
Okay.
because they used a synthetic progestin called MPA.
Okay.
And that does come with certain risks. But bioidentical progesterone, or P4, doesn't carry those same risks.
So it sounds like choosing the right type of hormone therapy is crucial.
It really is.
And, I think some of our listeners might not be familiar with that term, bioidentical hormones.
Right.
So can you explain a little bit more about what makes those different?
Of course. So bioidentical hormones, they're designed to be molecularly identical to the hormones that your body naturally produces, and are generally considered a more natural and potentially gentler approach to hormone replacement.
That makes sense.
Yeah.
So it's not just a one-size-fits-all situation.
Right.
And Dr. Wu really emphasizes that, bioidentical hormone therapy, when it's properly prescribed and monitored,
Yeah.
can be a safe and effective option for many women.
Absolutely. But he also stresses the importance of a holistic approach,
Okay.
a lifestyle strategy he calls Safe Life.
I like that.
Yeah.
So tell us about that.
So Safe Life, it incorporates key areas like regular screenings for breast cancer,
Okay.
avoiding things that we know negatively impact our health, like obesity,
Okay.
smoking, excessive alcohol,
Got it.
prioritizing fiber and whole foods for gut health,
Okay.
engaging in regular exercise, and minimizing our exposure to environmental toxins like endocrine disruptors.
So these are all things that we have control over.
Exactly.
It's empowering to know that we can do things to help manage this process.
I agree.
It's not just something that's happening to us passively.
It's not.
And one of those key areas within that safe life strategy that I think we need to spend a little bit of time talking about is weight management.
Oh, yes, a big one.
Because this is a concern for so many women going through menopause.
Right.
I think a lot of women experience weight gain even if they haven't made any significant changes to their diet or their exercise routine.
Right, and that's a very common experience.
Yeah.
And it's directly related to those hormonal shifts that we were talking about.
Okay.
As estrogen declines, it affects your metabolism and how your body distributes fat.
Oh, that's interesting.
Yeah, and Dr. Wu points out that even without weight gain, menopause can lead to an increase in visceral fat.
And visceral fat.
A fat around your organs.
Oh, so even if the number on the scale isn't moving much, there could be changes happening internally that are impacting our health.
Exactly.
Wow.
Yeah, and research suggests that estrogen therapy might actually help mitigate those negative changes and help women maintain a healthier body composition during and after menopause.
Fascinating.
Isn't it?
It really underscores how interconnected our hormones are with our overall health.
Absolutely. And this brings us to another really crucial aspect of menopause that often gets overlooked, the mental and emotional changes.
Right. It's not just the physical symptoms. It's this whole emotional experience, too.
Exactly. And we've touched on mood swings and anxiety. But what about the deeper emotional challenges that women face during this transition?
That's a great point.
Yeah. And that's something that we're going to delve into further in the next part of our deep dive.
Stay tuned because we'll be back with more insights from Dr. Wu on navigating that emotional roller coaster of menopause, managing stress, and understanding the latest research on hormones, immunity, and disease prevention.
It's going to be good.
So much more to come.
Can't wait.
See you soon.
One of the things Dr. Wu really emphasizes is how our perception of risk can be totally skewed. By the way information is presented.
Yeah.
We see these headlines.
Oh, yeah.
And they can be really scary.
For sure.
And he really dissects the way data, especially from studies like the WHI, can be kind of misconstrued and fuel unnecessary fear.
Especially when it comes to hormones.
Especially with hormone therapy.
It's true. I remember when those initial WHI findings came out, it felt like everyone was suddenly terrified of hormones.
Oh, yeah. Everyone was freaking out.
But I'm also curious, what's the alternative?
Right.
If you're really struggling with severe symptoms and lifestyle changes aren't enough.
That's a great question. And it brings us to this crucial point that Dr. Wu makes. About understanding the difference between relative risk and absolute risk.
Okay, relative versus absolute.
Yeah, he uses this really clever analogy.
I love his analogies.
No, he's great with them.
Yeah.
He uses the lottery ticket.
Okay.
So imagine you buy a ticket,
Mhm.
and your chances of winning are 1 in 14 million.
Okay. Pretty slim.
Right. Someone comes along and says, hey, I can double your chances. A 100% increase.
You'd think you're practically guaranteed to win at that point.
Right. You'd be like, oh, I'm going to be rich.
Right.
But in reality, your chances have only gone from 1 in 14 million to 2 in 14 million.
Bro.
So the relative risk has doubled,
Uh-huh.
but the absolute change is tiny.
You're still incredibly unlikely to win.
Exactly.
That's such a good way to explain it.
It really puts things in perspective.
Yeah.
And Dr. Wu applies the same logic to the WHI study.
Okay.
So the reported increase in breast cancer risk associated with combined hormone therapy was 26%.
Okay. 26%.
And that's a figure that understandably grabbed headlines.
Yeah. It sounds scary.
Right. But when you break it down, the absolute risk,
Okay.
the actual number of additional cases per 10,000 women
Mm-hmm.
was only 8.
8 out of 10,000.
Exactly.
It suddenly feels a lot less daunting when you frame it that way.
Doesn't it?
Yeah.
It really highlights the importance of context.
Right.
Dr. Wu goes on to compare this risk to other risks that we routinely accept in our lives.
Okay. Like what?
Like, for example, the risk of developing acute kidney injury from taking common over-the-counter pain relievers.
Oh, like NSAIDs?
Yeah, like ibuprofen or naproxen.
Okay.
That risk is significantly higher,
Really?
somewhere between 1 and 5%.
Wow. I think a lot of people take those without a second thought.
I know, it's like, oh, I've got a headache, pop a couple of Advil.
Right.
But there are potential risks there.
That we don't always think about.
Right, and think about something as commonplace as driving.
Okay.
In 2021, the accident rate for cars and motorcycles in Taiwan was 140 to 150 cases per 10,000 vehicles.
So the absolute risk of breast cancer from combined hormone therapy, as per the WHI study, is actually lower than the risks associated with activities that many of us do every day.
It's true.
It's amazing how easily our perceptions can get skewed by the way information is presented.
Especially in the media.
Right. It's like those clickbaity headlines.
Exactly.
So it's really about, informed decision-making when it
Yeah.
comes to our health.
Absolutely.
We need to do our research.
Yes. Dig deeper.
Look beyond those headlines.
Understand the data.
Weigh the benefits against the risks.
And when it comes to hormone therapy, it's not a one-size-fits-all approach.
You mentioned earlier that Dr. Wu specializes in bioidentical hormone therapy.
Yeah.
So what are some of the advantages of that approach?
Well, bioidentical hormones, as we touched on before, they're structurally identical to the hormones your body produces naturally. This means they may be better metabolized and have a lower risk of side effects compared to synthetic hormones.
So it's about finding that sweet spot.
Yeah, the right balance for each individual.
Now, you've also talked about Dr. Wu's Safe Life strategy,
Yes,
which highlights the power of lifestyle choices
absolutely.
in managing menopause symptoms and reducing long-term health risks.
So let's revisit those key elements of Safe Life.
Yeah, such a great framework.
I love it.
It's practical.
It's actionable.
Yeah.
So remember, it stands for screen, avoid, fiber, and whole foods, exercise, and environment.
Okay. Screen, avoid, fiber, exercise, environment.
Exactly.
Yeah.
So it encourages regular screenings for breast cancer and other health concerns.
Okay.
It emphasizes avoiding things that negatively impact our health, like smoking, excess alcohol, processed foods.
Makes sense.
It promotes a diet rich in fiber and whole foods to support gut health.
Oh, and gut health is so important.
It's crucial for hormone balance.
That's interesting.
Yeah, there's this fascinating connection.
Can you talk a little bit more about that? It's like the gut and hormones.
So there's this interplay between our gut microbiome,
So the microbiome.
all those trillions of bacteria living in our digestive tract.
It's like a whole ecosystem in there.
It really is.
Wow.
And our hormone production,
Okay.
the gut microbiome actually plays a role in metabolizing and regulating hormones like estrogen.
So when your gut health is compromised, it can really throw things off.
It can impact your hormonal balance, for sure.
Wow. So what we eat and how we care for our gut can actually directly influence our hormone levels.
Exactly. That's why Dr. Wu emphasizes the importance of a diet rich in fiber, probiotics,
Okay.
to support that healthy gut microbiome.
And this ties back to the weight management piece as well.
It does,
Right.
because weight gain during menopause is often linked to those hormonal shifts
Mm-hmm.
and can further impact our overall health.
And Dr. Wu reminds us that it's not just about weight.
Right.
It's also about body composition.
Exactly. You might not have gained a significant amount of weight, but you might still be experiencing an increase in visceral fat.
Which is that.
Fat around your organs.
Right. And that can increase the risk of things like heart disease, diabetes,
Yeah.
all sorts of other issues.
And as we discussed earlier, research suggests that estrogen therapy may help counteract those negative changes and promote a healthier body composition.
It's amazing how all these pieces fit together.
It's like a puzzle.
It is.
But it's empowering, too,
Right.
to realize that we have more control over our health during menopause.
And we might think.
Exactly. And speaking of empowerment,
Yes.
let's shift gears a little bit
Okay.
and delve into the emotional landscape of menopause.
This is a big one.
It is a topic that often gets overlooked.
Yep.
You know, it's not just about the physical changes.
Right.
It's about the whole experience.
The mental and emotional shifts
Exactly.
that occur during this transition.
Absolutely. And we'll explore Dr. Wu's insights on navigating this emotional terrain
Okay.
in the next part of our deep dive.
Stay tuned as we continue to uncover the many facets of menopause.
Yeah.
And discover how to not just survive,
Right.
but thrive
Thrive.
during this transformative stage of life.
Absolutely.
Welcome back to our deep dive on menopause. We've been talking so much about the science of hormones and how they play a role in this whole transition. But, we also have to talk about the emotional side of things.
Absolutely, because it's a huge part of the experience.
Yeah, it is.
You know, those hormonal fluctuations can really mess with your mood
Oh, yeah.
and lead to, irritability and anxiety and sadness even.
Yeah, like a feeling of grief sometimes even.
It is. It's like being on an emotional roller coaster.
Yeah, it really is. And I
Yeah.
think, it's important to emphasize that these emotional changes are not a sign of weakness.
Oh, absolutely not.
It's not something to be ashamed of.
Definitely not.
It's a natural response
Yeah.
to what's happening in your body.
Your body's going through a lot.
Exactly.
Uh-huh.
So how can women kind of navigate this emotional turbulence?
Right. Well, Dr. Wu, he really emphasizes the importance of self-care during this time.
Okay, self-care. So, like bubble baths and face masks.
Well, it can be those things, but it's really about prioritizing activities that nourish your mind, body, and spirit.
Okay, so it's about tuning in to what makes you feel good
Yeah,
and making time for those things.
exactly. It could be yoga,
Okay.
meditation, spending time in nature,
Mm-hmm.
listening to music,
Yeah,
pursuing a creative hobby.
whatever brings you joy.
Right, and making it a regular part of your routine.
And speaking of routine, getting enough sleep is so important.
Oh my gosh, tell me about it.
I'm a mess when I'm sleep deprived.
I know, me too. And it's so common during menopause.
Yeah, sleep disturbances are a big issue.
Huge. And they can make those mood swings even worse.
So what can we do about that?
Well, Dr. Wu recommends, establishing a regular sleep schedule,
Okay.
creating a relaxing bedtime routine.
Like no screens before bed.
Exactly. And
Yeah.
avoiding caffeine and alcohol before bed.
Makes sense.
Yeah, those are some simple things you can do.
Now, I'm also curious about the role of hormone therapy
Right.
in managing these emotional challenges.
Yeah, is that something Dr. Wu recommends?
Exactly.
He does for some women.
Okay.
Hormone therapy can be really helpful in managing those mood swings and other emotional symptoms
Mm-hmm.
because it helps restore that hormonal balance.
Okay.
But again, it's not a one-size-fits-all solution.
So it's about having that conversation with your doctor
Absolutely.
and figuring out what's right for you.
Yeah, personalized care is key.
Now, before we wrap up, I want to touch on one more area where hormones play a role,
Okay.
our immune system.
Right.
We know that menopause can increase the risk of certain autoimmune diseases,
It's true.
but that connection can be pretty complex.
Yeah, it's fascinating, actually.
So break it down for us.
So estrogen and progesterone,
Mhm.
they have these things called immunomodulatory effects.
Okay. Immunomodulatory effects,
Meaning they influence the activity of our immune cells. And so when those hormone levels decline during menopause,
yeah.
it can disrupt the balance of the immune system.
Oh, so it's like our bodies become more susceptible to these kind of internal misfires.
Yes, exactly. And there's research suggesting that hormone therapy might actually help reduce the risk and severity of some autoimmune conditions.
Interesting.
Yeah, for instance, studies have shown that estrogen therapy can improve joint function in women with rheumatoid arthritis
Okay.
and even reduce symptoms of Sjogren's syndrome.
Which is
It's an autoimmune disorder that affects moisture-producing glands.
Okay, so like dry eyes, dry mouth.
Exactly.
So that's really valuable information,
Yeah.
considering how prevalent autoimmune diseases are in women.
It's true. They estimate nearly 80% of people with autoimmune disorders are female.
Wow,
So
80%.
it's a big deal.
That's huge.
It is. And it really highlights the need for greater awareness
Yeah,
of this hormonal connection to these conditions.
it's all about connecting the dots.
Exactly.
Seeing that bigger picture.
Yes, and I think that's what Dr. Wu does so well in his work.
Yeah.
He helps us understand these intricate connections
Mm.
and really empowers women to take control of their health during this time.
This has been such an eye-opening conversation.
I agree.
I feel like I've learned so much about menopause
Me too.
beyond just, hot flashes and night sweats.
Right, it's so much more than that.
It really is.
Yeah.
So as we wrap up our deep dive,
Okay.
what's the key takeaway you want to leave our listeners with?
Well, I'd say the most important message is that menopause is not a disease.
Okay.
It's not something to be dreaded.
It's a natural transition.
Exactly. It's a natural transition to be embraced.
And with the right knowledge and support,
Yes, and a proactive approach to health and well-being.
women can not only navigate this stage of life with grace and resilience,
Absolutely.
but thrive in the years to come.
Thrive.
I love that.
Yeah.
And I just want to echo that sentiment. This deep dive is just the beginning of your journey.
Yeah, the beginning.
Don't be afraid to ask questions. Seek guidance from healthcare providers who specialize in menopause and hormone therapy.
Yes. And listen to your body.
Most importantly, listen to your body.
Trust your instincts.
Yeah, thank you so much for sharing your expertise with us today.
It was my pleasure.
It's been so enlightening. And to our listeners, thank you for joining us on this deep dive into menopause.
Yes, thanks for being here.
We hope you found it informative and empowering.
We hope so.
Until next time, stay curious, stay informed,
Stay well.
and stay well.